Hi, pet parents. I just wanted to come to you with a urgent message to hopefully calm some fears and give you some information and maybe prevent some illness out there. I'm Dr. Matthew Wheaton of Alicia Pet Care Center, and I'm here to talk to you about this new respiratory problem that we have emerging in dogs, actually across the entire country. This is a very interesting situation and obviously concerning as you see the headlines, and everybody's getting very nervous about this. We know very little about this, to be honest with you. There is a lot of information that is to be gained in the near future from people looking into the hows and whys and looking at the different organisms that are potentially being found in some of these dogs. But the bottom line is this, that we have a new respiratory problem that is infectious in nature, very likely. There is a possibility that this is a bacterial infection that is potentially a new bacteria that is maybe something that dogs have had for a while, but recently had some degree of either a mutation or some kind of virulence that happened to the actual strain of bug. Theoretically possible that it's a virus, but so far known viruses are coming up negative on the testing that is happening across the country. These dogs are becoming sick with upper respiratory symptoms. Typically it's cough, but could also be nasal discharge, sneezing, that kind of situation. Some of these dogs are quite sick, so some of them have presented with pneumonia. Some of them pneumonia dogs have actually died. So it is a possibility that this has severe impacts on individuals, but this is a spectrum disease most likely, where we have very, very mild cases. Probably the majority of them are going to be, treated as outpatients and not hospitalized, but there are going to be a small group of dogs potentially that have much bigger issues. Some of these dogs, in a worrisome way, have progressed really rapidly to their demise in a matter of potentially 2 days after illness symptoms started to show up. So it's very concerning, of course, as we certainly want to nip this in the bud, but it's very early on, and so we're in a situation where we don't really know what the organism is. We probably don't have immunity across the board because it's probably a new organism or a sort of new strain of an organism that there isn't immunity for, and we really are probably not going to have that knowledge for several months. We also are probably not going to have any preventatives, so there's not likely to be a vaccine that's, sort of magically appears. We're probably years away from a vaccination, if that's even something that is possible. So right now, I think the important thing is to be aware that this is a likely contagion, so it's likely going to happen from one dog to another. Those cases are typically coming out of high volume situations where you have a lot of dogs in a small indoor location typically. So boarding facilities, groomers, play groups, daycares, that type of thing. So those are the things that you want to really make sure that your need is high enough that it warrants embracing that potential negative consequence of your dog becoming sick. You also have the contagion issue in your environment. So if your dog gets sick, we definitely don't want to spread that, so it's really important to kind of keep that in mind. Kind of going back to just being conscientious about your decisions and understanding that there's consequences to those things, and really trying to set the world up, let's say your local environment, for not having this problem escalate into a much bigger issue. Veterinarians, again, have only so much space in an isolation ward, relatively small spaces in almost every animal hospital. So having multiple dogs come in that need to be isolated if they're having to be hospitalized is very problematic for us, because we just not going to have the cage space for management of those dogs. So trying to keep it sort of a flattened curve, that kind of thing, is also important. So again, if you don't really need to have your dog in one of those higher risk environments right now, it's probably best to avoid that. Life goes on, and so sometimes you need to actually do that. Some dogs need to be groomed every 6 weeks or else. Sometimes there's vacations that are planned that can't be canceled, so you're going along with your boarding plans. But keep those things in mind, that there's some risks, some inherent risks that you're embracing when you enter into these kind of situations. Symptoms of disease are typically respiratory, so coughing being the primary one. Sometimes it's difficulty breathing if we've already had that case escalate to a pneumonia. What we're really hoping for everybody to do is to go to your veterinarian for care when you notice those problems, and be making sure that you're communicating those things to your vet staff so that we have your dog set up for the best scenario to minimize spread of disease while your dog is at the animal hospital. And time is of the essence with this. Obviously, if you start to notice that your dog is having coughing issues or respiratory problems, you want to act on those things as quickly as possible. Additionally, you want to try to allow for your veterinary team to do necessary testing here. Because we're dealing with an unknown situation and lots of questions, and also a situation with kennel cough where we have 12 different organisms that are out there that could also be going on at the same time, and maybe it's actually one of those issues. So ideally, when we have these cases coming in, we're able to do the testing that we want, which is generally a PCR test, which is a DNA test looking for those organisms, also doing a culture, looking for bacteria to grow, and then potentially x-rays of the chest to define whether or not there's pneumonia. Those are important steps for us to kind of track down what the actual offending organism is and be better off dealing with that problem. Again, treatment is important, so obviously you do the treatment that your vet recommends, ideally the best treatment so that we have the best outcome. This is a great time to get your pet insurance in order if you don't already have that. But the additional thing is really trying to make sure that you're trying to minimize additional exposure. So if your dog was exposed to a known issue, you want to try to quarantine that dog for 2 weeks. If your dog gets sick with this problem, we want to try to quarantine that dog for a month from the time that the treatment initiated. And these are broad categories that we potentially will change, but that's our initial recommendations at this point. Again, there's no magic bullet for what you can do to avoid getting sick. It's primarily to avoid other dogs that are potentially sick. And again, you may not know that the other dog is actually sick. So trying to really try to measure the need for those group activities and weigh those against the risk of getting sick. We will update you as more information comes out. This is a changing problem, an evolving problem that I am very confident that our veterinary community will get their heads around and have great recommendations for us to be able to help our patients long term. In the meantime, try to stay safe and try to advocate for your pet's health as much as possible through quick responses to these things. If you have questions, feel free to ask them from your vet team, and we will strive to continue to keep taking care of your babies. So we're going to go into the questions. First one is, how soon would a dog have symptoms after exposure? So a lot of these things we're going to say we don't know yet, but we don't know yet. If it's a typical respiratory bug, and bug means bacteria or virus, then it's typically like 2 to 7 days is the typical kind of incubation period. Some things can take up to 2 weeks. Occasionally that's something that even is longer than that, but it's going to be kind of like 2 to 14 days, but majority of the dogs are going to be 2 to 7 days after exposure. Okay, next question. How does it spread? So we don't know, but this is likely a respiratory virus or bacteria. Maybe leaning on the bacteria side if you listen further. I'll explain that. But it is a respiratory problem, so probably it is airborne spread, so kind of like the dreaded COVID. It's going to be mostly droplet and, just off-gassing your virus or your bacteria. But it's possible that there's some degree of contact exposure that's possible as well. So, if you have an infection and you're having a respiratory problem, coughing, sneezing, those kind of things are going to actually have droplets come out that are actual physical droplets, and those things can stay on surfaces and they could be contagious for a little while, maybe several hours, maybe a day or two. One of the things is we probably would avoid the communal dog dish, dog water bowl at a dog park, something like that. I think would be kind of like high risk as far as non-nose to nose or in an enclosed environment with a lot of dogs. That's the more likely exposure that you're going to see. Okay, next question. Can they get it again? We don't know. Presumably there will be some degree of immunity to this that's obtained by the actual dog that got infected. We don't know, can't say that for sure, but more than likely that's going to be the thing. Again, just like with COVID, you can still have immunity and still get infected again, and presumably your second infection is going to be less severe than the first one because you're going to build up some degree of antibodies and cellular immunity and all of that kind of stuff. How long does it live on surfaces? Don't know. Don't know what the problem is. Don't have an agent pinned down, so we don't know, but presumably this is going to be one of those things that's going to last for several hours on surfaces. If there was a dog that coughed up a loogie, then that loogie is going to be a protective mucus layer that's going to protect the bacteria or virus for some degree of time. Probably not 3 days, but theoretically maybe a day or two. Should I cancel my pet's wellness appointments, dental, vaccine appointments? I would say, I'm a little bit biased here, but I would say no. And if I'm looking at it from the patient's perspective, ongoing healthcare needs to keep happening. This is not a full-blown, massive outbreak that is widespread in every region every day. This is not a situation where we have half a dozen to a dozen dogs presenting at our multi-doctor practice every single day. We may have 1 to 2 dogs every day. I think that's kind of been the flow, somewhere between 0 and 2 dogs per day over the last several weeks. But I don't think that that's not a high number that you're going to likely be significantly exposing your dog to contagion. Plus, every veterinary hospital is going to have some control measures here. We definitely have a lot of them. We're going to be asking questions ahead of time on symptoms. We're going to be routing those dogs that have any respiratory problems, regardless of what it actually is, into particular examination rooms that are away from the other animals. Those dogs are going to go in and out quickly of the hospital. We're not going to have them in the hospital for an extended period of time if we can avoid that. If we do have that situation, then we're going to move them into our isolation ward, which we can have, it's a totally different airflow mechanism. So all the air is, not going throughout the entire animal hospital. And we have a lot of cleaning protocols in place that are, kind of carryovers from our COVID era, where we're actually really being very successful at minimizing contagion. And to this point, this has been going on probably since July or August, actually. We have not had any in-hospital spread. So I think most animal hospitals are going to provide that kind of precaution that is going to be really helpful to avoiding having the non-sick dog come in here and then become sick. Theoretically possible, but not likely. And I think ongoing healthcare is really, really important. We don't know how long this is going to last. My guess is this is here to stay. Hopefully not, but my guess is that this is going to be a new thing that's going to be, just a new part of our upper respiratory disease complex in dogs. So. I work at a boarding facility. Should I be concerned about transmitting this to my dogs at home? What should I do to stop transmission? And that's a very valid thing. It comes back to the whole droplet thing that I was talking about before. But, if you're working with dogs and you have dogs at home and you want to keep those dogs safe, it is best for you to do kind of until we know more, shed your clothes in the garage, do that kind of thing where you're changing out of your clothes and not having your dogs get exposed to your clothes that might potentially be, having organisms still on them. Throw them in the washing machine. High temperature cleaning should do the trick more than likely. So those are things just normal precautions. Your shoes, your clothing, wash yourself, hands. I don't think you necessarily need to go and take a full-blown shower, but again, we don't know what the organism is, so it's hard to answer that question perfectly. Should I wipe down my pet's paws after walks? I don't think that that's very likely that you really would get a benefit there. That's a lot of work for probably an extremely small payoff. Just again, think about it. You have to, if you had to do that, that means that your dog is actually walking in droplets, which is very, very unlikely, no matter where you're living. It's very unlikely that your dog is going to be walking in another dog's sputum that's within 24 hours old. It's just not likely. So the chances of them then licking their paws and that kind of thing, it's a big stretch on contagion. So very unlikely. We're not seeing that kind of stuff. Almost all the dogs that we're seeing have some kind of high risk story in their recent past, whether it's a daycare facility, play group. A lot of this is indoor, boarding facility, that kind of thing. I live in an apartment, and the only way my dog goes to the bathroom is going on walks. So what should I do? You need to have your dog go on walks. That's, trying to keep this in balance here. Throwing everything out the window is not right. So, try to maintain a consistent lifestyle for yourself and for your dog. Don't lose your mind over this. Again, I don't want to make light of it because it's a real issue. There are fatalities, but they are very, very small in number. The majority of the dogs are going to be in this, mild to moderate group. Maybe it takes a lot longer. Maybe there's some questions because you don't have a solid diagnosis because the testing comes back all negative. Maybe your dog is on treatment for 2 months or something like that. But the vast majority of dogs are not going to have very, very severe illness. Again, at this point, that's what we're seeing. So I think, keep it all sort of in check. Continue to keep walking your dog out there. I think, avoiding nose-to-nose contact with other dogs that you don't know is prudent. But again, there's a balance there. I had a conversation with somebody yesterday. They have a dog that needs training, and this dog is 6 months old and is already anxious, and that dog needs to get exposed to other dogs, and the window is very small for that dog. So we need to continue to keep doing socialization for certain aspects of certain dogs. Some dogs need exercise, or they lose their minds, or they're misbehaved, or they're tearing up the house or something like that. So there's going to be a balance that needs to be struck, and I think it's, again, a dirty pros cons list to measure this stuff, but for the most part, I think the regular normal activities are going to be continued for the majority of people. You don't have to, now isolate your dog continuously and do that kind of thing. Should I still board my pets this holiday season? That is a pros cons list that you need to weigh out. I had somebody in here yesterday. He's going to New Zealand. This is a trip that's been planned for over a year. This is a 50-year wedding anniversary trip. Don't cancel that trip. Don't cancel that trip. Take on your risk. Again, there are risks, just like going on an airplane or driving in your neighborhood. So understand that there's some inherent risk in things that we do. But I think risk reward, go on the New Zealand vacation and celebrate 50 years of your wedding anniversary, makes total sense. The dog is not likely to be the unlucky dog that gets infected. However, it's possible. So you need to come to grips with those risks. Everything in life kind of has consequences to our decisions, and this is one of those things that you want to think about it, but be rational about it and continue to keep, trying to live a fulfilling life. Can cats get it? At this point, we say no. We don't know of any cats that are coming down with this condition. I think we would probably know by now. My pivot to that is probably what we will figure out after the fact. When we find out what the actual organism is, we will probably find out that dogs can actually give it to cats, but maybe cats don't get symptomatic. So maybe cats can be a carrier. And again, that's kind of what we saw with COVID, right? Where you've got zoo animals that were getting infected with COVID, and they might not have had any symptoms at all. And they, theoretically, it's not going to be passable from them. So there might be some of this kind of interspecies play. Hopefully not. Hopefully this is specifically a dog thing, but at this point we don't think that cats are actually becoming clinically affected with the disease. Final question, would an at-home groomer be okay? I think an at-home groomer does minimize your risk to some extent, because going to a groomer is one of those things where you have a large number of dogs that are all under one roof and breathing the same air. And the thing about the grooming situation is, a lot of the grooming kind of has to happen. If you have a doodle, but you have to keep doing it. So I think sometimes that is a little more challenging because people are under, pressure to do the grooming. And so they're going to do the grooming theoretically with a dog that's still coughing, and they don't really realize, and maybe there's not as many control measures in it, the particular groomer that you end up in, there may be a chance of spread at the groomer. So if you're using a mobile groomer, I think you limit some of that because there can only be so many dogs in a mobile groomer's van. Usually it's one dog at a time. So I think that does minimize some of the risk associated with grooming activity. Try to keep it in check, people. I know that this, the urgent message gets attention and there's a lot of news stories, and that's, part of our reasoning for getting the message out yesterday is really just to make sure that we are educating rather than having the media educate. There is a study out of New Hampshire, I believe, that is looking at about 35 samples, and they think that they are looking at a very, very small bacteria that potentially has been in dogs for a long period of time, that had some kind of change, either picked up some genetic material along the line or had a mutation and became more aggressive. That means, it's more likely to be infectious, more virulent. And with that, we have this new thing. That's what the thought process is right now, but that's really preliminary. That's only one entity that's kind of reporting this, and there's ongoing work, so we don't really know entirely for sure just yet. And yes, it's going to be frustrating. It's going to be expensive. It's going to be scary if your dog gets infected with this, but it doesn't necessarily need to be so scary. If you have pet insurance in place and you understand that the vast majority of dogs are going to do okay, it might be, extended period of time with an infectious cough, but the vast majority of these dogs are going to do all right. Again, take precaution, think out your decisions, understand that there's negative consequences associated with every decision that you make in life, and set yourself up for success financially so that you have pet insurance in place, because again, veterinary medicine is very expensive. It's only going to get worse because we have a massive shortage of veterinarians and staff, and we also have inflation and all this other stuff that is factoring into it's going to become more expensive to get your pet veterinary treatment, but it is just the facts. So get your pet insurance in place ASAP so that you have that ability to do whatever needs to be done in that moment, because operating from a place of hope is not perfect in that situation. So hopefully this has been helpful for you. I'll come back and do another update when we have more information, and hopefully this answers the majority of the questions that are out there. And wish you luck, and be well, be safe. Bye.